Hello everyone, I'm Dr. Angela Mattke, and you're watching Ask the Mayo Mom on Facebook Live. I'm a pediatrician at Mayo Clinic Children's Center. Twice per month, I host a show about pediatric health topics where we take and answer your questions live. Today, we will be discussing the importance of routine well-child appointments for all children and adolescents. Joining us to discuss this important topic is Dr. Valeria Cristiani. Dr. Cristiani is a community pediatrician at Mayo Clinic Children's Center. She is the Ask Mayo Expert Pediatric Knowledge Prevention Content Board Chair. Dr. Cristiani is also a founding member of ECH School Health Program and the Alternative Learning Center Clinic Medical Director, which is a school-based clinic for adolescents in Rochester, Minnesota. It's going to be a great discussion today, so please send your questions in under the Facebook Live video feed, and we'll try our best to review them during the live broadcast today. So Dr. Cristiani, thank you so much for joining us.
Yeah, thank you for having me.
You're one of my partners, and we both are primary care doctors in pediatrics.
Yes.
And so doing well child visits is really a fundamental milestone and a fundamental thing that we do to promote well child visits for children.
Exactly.
Or, health for children.
Yep.
So tell me a little bit more, and so everyone can kind of understand why well child visits are so important to promote healthy children.
So as you know, one of the things that we do as pediatricians is partner with parents and families and our children, patients, and teenagers to make sure that they remain as healthy as possible so that they can, achieve their full potential. So one of the greatest gifts of being a pediatrician is that we share, the growth of children, and we see them from the time that they're babies until, they graduate, sometimes even from college. So in that journey, we primary care providers are partnering with parents, and well child visits are a great opportunity to make sure that we are being proactive so that we are doing screenings for things related to health that could be wrong. And so we want to be proactive. We want to prevent disease.
Absolutely. It's a lot harder to treat it once it occurs, right?
Exactly right. So that's why for, many decades, the American Academy of Pediatrics and the national organizations that support family medicine providers have recommended a schedule of well child visits that happen throughout kids' lives. And so many parents know that when they're even expecting, that's also a great time to start thinking about, so who's going to take care of my baby? And so that, I think, is a great opportunity for parents to start exploring in their communities who do they want to be their child's primary care provider. In many places in the United States and abroad, parents can meet with primary care providers even before the baby is born. Some other parents prefer to wait until the time of delivery, and so at that point, usually depending on where they are, they find a pediatrician or a primary care provider, and then they start doing the well child visits. As many parents know, usually in the first few years of life, so I would say up to 2 years of age, the visits are a little bit more frequent than what happens after children are in preschool or in school age years or as teenagers. So in the first 2 years of life, we see them as primary care providers in well child visits a little bit more often. So that, we see them right after birth to make sure that the baby is growing well, that breastfeeding is going well, that we're supporting nutrition, that we're supporting that family in those very first exciting but also very tiring few days of lives. And there are specific things that the primary care provider will be looking to review at those visits. We want to make sure that they grow well, that if they have something that is very common that is called jaundice, which is that discoloration, the yellow colors of the skin of babies that happens very commonly because their livers are still maturing. We want to make sure that is within the normal range, and so that's something that the primary care provider will be checking. But anyways, in terms of, why are those checks, well-child checks or well-child visits important? I would say definitely for prevention, to make sure that we are following them along, that we can do a history, which what that means is we ask questions and we ask for concerns that parents may have, and then we do a physical exam to make sure that that the heart, the lungs, that all the parts of the body are normal. And then we kind of like do a plan together for that visit, like what other preventive services should we do at that visit, and then we figure out a plan for next time.
So in the first year of life, you mentioned it's a little bit more frequent, and then when they get into the preschool years, it's less frequent. Can you talk about what is kind of recommended for the frequency of follow-up, just so families are sometimes wondering, when's my child due for their next visit? Am I overdue?
Right. Yeah, exactly right. So first I would say anytime that a parent or a caregiver has a concern about their child's health or their baby's health or their teen's health, that is the right time to reach out to their pediatrician, family medicine provider, etc., because to be honest, I think we know that parents are the ones that they have that gut feeling, and they are the ones that are the experts. So we are experts with them, but we as primary care providers always take the parents very, very seriously. So even if it's not in this technical schedule, I would encourage you all parents to be the ones reaching out and schedule a checkup, even if it's not actually due. But in general, if children are healthy and parents don't have concerns, we want to monitor growth and other things that we can talk about throughout the hour. At least once they turn 3 years of age, usually is yearly, so at least once a year, and that is what the American Academy of Pediatrics usually recommends, and that's the schedule that in most places in the country they follow, and abroad as well.
Okay. And at Mayo Clinic we do things just a little bit different, so if any of our patients are watching, you want to share what that is?
Yes. So for the past probably 10-15 years, we have decided to listen to families, and we found out that when in general children are healthy, when they don't have a chronic illness or they don't have a condition such as, for example, asthma or chronic headaches or skin disorders or a heart issue or whatever it is that they may have, if they're completely healthy, they're not taking any medications, I think that we allow families to come and see us every 2 years instead of every year after the age of 3. And in these past 15 years, I've found that my families that I see in general, the children are totally fine, and they don't I don't find that children that come every 2 years that are healthy do worse compared to the ones that come every year. But that also is kind of like a practice in a parent's choice. So again, I think that the parents always have if they are concerned or if they want to see their primary care provider a little bit more often, they definitely can.
Because all insurance in the United States will cover well-child visits yearly for kids past the age of 3.
Yeah,
so.
Exactly right.
Excellent.
Yeah.
So you mentioned at different ages, sometimes there's different things that we focus on. But there are some unifying things that we still check regardless of their age.
Yeah.
And there's so many things that we are thinking about at our visits that sometimes parents might not even realize that we are assessing. So can you talk about some of those things that are really crucial at the well-child visits?
Yes. So in general, we always are assessing growth and development. That we do throughout the lifespan. So we know what are the questions that we have to ask when we have a newborn, we have a 2-month-old, but also what are the questions regarding development that we have to review when they are a 5-year-old or an 11-year-old or a 18-year-old. So growth, we do that through the growth charts. Those are standardized charts that in general, actually, we use the World Health Organization growth charts that are, approved by the World Health Organization, of course, and by all the national organizations that take care of kids. And that is, I would say, one of the most important things, along with immunizations, that we do on a well-child visit. Because if your child is growing, and we assess not only weight but also length or height, and also we, in the first 3 years of life, we make sure that the head is growing appropriately. If growth is going well, that is extremely reassuring. And thanks to these well-child visits, we actually can catch things that need to be taken care of. Like, for example, there are some children that may not be eating enough.
Right.
And so that is a common cause for the weight to not go up. And so if that's the case, usually, maybe depending on the child, but in general, maybe 6 months, maybe a year later, then the height doesn't go up. And so height velocity is something that we take, we pay a lot of attention to, as long as growth. The other thing that is very important to assess is that weight of the child appropriate for how tall they are? Exactly. Because as we all know, we as Americans, and actually across many countries, I'm originally from Argentina, and I see that every time I go back, there's a childhood obesity is unfortunately an epidemic. And so the ability to make sure that we start talking about healthy eating from the get-go, like even from the prenatal years to, or the prenatal time until in that first year of life, making sure that babies and mothers are, having a good feeding relationship, and then making sure that in the preschool years, parents don't feel like they have to force feed kids because how normal. Exactly right. Exactly right. Yeah. So I think that seeing your pediatrician for a well-child check, or your primary care provider, is a great place to do growth and check how they're growing and adjust things as needed. Development, again, we touched a little bit briefly on that. I think that many provider offices and practices across the country now have standardized instruments to assess for normal development, to make sure that the socialization is healthy, that their ability to move is healthy, that they can use their fine muscles appropriately, that they are speaking and developing language appropriately, and not that there might be like a vision or a hearing concern. So all of those are things that we assess all the time. We also pay attention to safety. I think safety is another big one that we kind of tailor to each family and according to the age group, right? For example, in the infant year, so in the first year of life, we concentrate a lot about preventing sudden infant death syndrome with safe sleeping recommendations, and empowering parents to discuss what their beliefs are around safe sleeping practices, and then figuring out what we as experts give them the evidence. We recommend back to sleep, and try to have the crib in the parents' bedroom for the first year, and and you may use the pacifier at night, and etc. But we definitely partner with the parents. But safety, another big one is car seats and booster seats and helmets, and gun safety. We know that we know that 1 out of 3 American households have some sort of firearms in their homes, and so that's our reality, and that's totally fine. I think that the most important thing is that families that own guns or firearms, that they store first of all, that the firearms are locked, and that the ammunition is stored separately. Those are the only 2 things that if families follow that advice, we can prevent so many injuries.
Exactly. Absolutely.
Yeah.
Absolutely. There's other things that we talk about, like emotions and behaviors and discipline. And we're seeing, a lot of children struggling with emotions and behaviors. And it's because sometimes starts early. So it's a conversation that we start early and we move on to continue through the adolescent years.
Yes.
And I really want to talk about, the well child kind of, what we talk about changes as we get towards, middle school and the adolescent age. Can we talk a little bit about what's really important for parents to know about how that visit structure might change and how confidentiality may be a part of that visit as well?
Yeah, that's a great question. So when we want to teach and empower teenagers to be able to have that safe space with their primary care provider to learn how to start taking care of their own health. The parents of the parents of an adolescent are still the parents, and and I've been through this, so I have some experience. But I think that we do want to give that safe space for teens to discuss things that they might not have thought that they could discuss with a parent, although usually in that space is when we primary care providers are kind of like listening and then helping them kind of like with the communication with parents, right?
These are things we do want them to have conversations
exactly
with, but we also want to give them that safe place that if they feel that they can't.
Exactly. So the visit usually is structured, and this may vary in the different practices across the country, but in general, the recommendation is to start the visit with both the adolescent and the parent, and we kind of like we ask first of all very open-ended questions, because we want to make sure that at that visit we are actually acknowledging and listening to what are the main concerns that both the teenager and the parent may have.
Right.
And so we start together then, and we actually state that I usually just talk to the teen, so we can pretend that you are my teenage patient. And so I say, so Angie, I'm so glad you're here today. I think that we're gonna start this visit together. We are with your mom, and we will, everything that we talk. When we ask your mom to step away from the room, it'll be between you and me. So that means it's confidential. But at the same time, and I say this in front of the parent.
Right, absolutely.
And but of course, if there is something that puts your life in danger or at risk, or something that can risk the life of others, then I have to tell your parent by law. And I say that because I think it's important for the teen to understand that that I, as the primary care provider, will be respecting their confidentiality, but there are safety things that basically go above that confidentiality. And then the parents, in general, actually, they value that time that the primary care provider can have with their teen, and then we call them back and finish up the visit together to addressing what were the findings and what's the plan. So
one, I think, really important thing for families to understand is when your child turns 18, right, they're going to be primarily making all the medical decisions and needing to reach out and schedule appointments and whatnot, but that you don't just magically turn that on at 18.
That's right.
So you want to facilitate your child and their self-efficacy and being able to advocate for themselves. And they can practice that during that time when they're with you. And so I say, we have this, time where we can practice you talking, asking questions, following up on things. Because I think most of us don't want to be helicopter parents.
Exactly.
And be managing our kids' life once they're adults.
Exactly.
We want them to do it with a little guidance during this time.
I totally agree.
Yeah.
Yes, exactly right. Yes. The other thing that we are seeing in, as you mentioned earlier, that we're seeing a lot is emotional health or, social emotional health issues. Yeah. I think that we do ask families, and we ask parents, we ask the children as soon as they can talk. So even sometimes I start like so early, even a 2-year-old I'm asking how they're feeling, etc. But I think social, emotional, and mental health is a big topic these days, and I think that it's very useful to have these well child visits as times when we can screen for issues around social, emotional, and mental health.
Because not only can we screen, we can also then help create a plan to help support that child.
Exactly right.
And so you want to make sure that, there's certain situations where screening wouldn't be a great idea, right? On the street or something like that, where we don't have support network to be able to get the child plugged in. And so we're doing that through different screening tools or with questionnaires.
Yes.
And a lot of different practices do different things. But
Exactly. Yes. The American Academy of Pediatrics has recommended that that we do social emotional screenings at least once in the first 30 months of life. We do developmental screening at least 3 times in the first 2 years of life. And then we do autism screenings twice in the first 30 months of life. So you see how in that first 2.5 years, I've said the words developmental screening, social emotional screening, and autism screening. So they're usually different tools, but I think it's so important that parents complete these and have a good conversation with their primary care providers, because as with everything, an ounce of prevention is much better than a lot of treatment. So and especially with emotions, the earlier you identify a concern, then you can draft a plan, and kids are so resilient and so plastic. Their brains are such an amazing organ that is kind of like changing so much in the first few years that the sooner you intervene, the better. So when kids are older, so when they're in the school years, we also do social emotional screenings, or it has a different name, but basically we're just checking behavior, and there's different tools for that, but it's always nice to have like a standardized questionnaire that practices can do, so that parents can say, are there any attention problems or concerns? These are there any conduct issues, or the defiance, or maybe kind of like withdrawing, or not sleeping well, or being a little bit worrying too much about things. So those are kind of like some of the main areas of these screening tools focus on. And then moving into the preteen and teenage years and youth, we do depression screening. That basically is so helpful, because when we do this, then we can identify, okay, so it sounds like there are some red flags here. Let's talk a little bit more about this before it turns into something worse.
Absolutely. So we're getting close to the end of our time, so I'm going to move on to talking about some other things.
Okay.
So sometimes labs are part of kind of routine preventive health screening. Can you talk about in what situations that would be recommended?
Yes. I would say that I would actually recommend that primary care providers do laboratory checks when they think that is going to, of course, benefit that child. So we know that some kids that maybe are at a higher risk of having, for example, iron deficiency, then in those children it makes sense to do a hemoglobin test or a blood test to check to make sure that their iron storages are okay, and that they're not anemic, which that means is that the red cells in the blood are a little bit low, and then they're a little bit more tired, they're not growing well, they could be fussy and irritable, and then you check and the iron was really low, and then you treat that, and boom, they're like a different person. So definitely are some labs that are important. I think that, so I would say iron deficiency comes to mind. Lead testing definitely comes to mind. We know that there are risk factors for lead. So when we live in communities where housing is older, or when we have lead in the water, or we have concerns about our partners or ourselves working in an environment that uses a lot of lead, such as welders, for example, that can increase the risk. And so that's something something that we assess. Is there a risk? And if there's a risk, then we recommend the testing. We also do questions about tuberculosis. That's another test that we could do. First, we do questions. Is your child we ask questions to see if your child is at risk for having been exposed to the bacteria that causes tuberculosis. And if that's the case, then we proceed with the test. The American Academy of Pediatrics also recommends cholesterol screening between the ages of 9 years and 11 years of age, and then again between 17 and 19 years of age. At Mayo, we decided not to do universal lipid screening. We have talked to experts, and at this point, we are still doing based on risk. So if the family history, etc., then we do it. But that's something that I talk to parents about, and it's something that they might hear from their primary care providers. Those I would say are the main important ones, yes. I think then it depends on whether at the well child visit we identified another issue, like for example when we have kids that are overweight or obese, or they have more weight for how tall they are, then we recommend a cholesterol screen, sometimes a diabetes screen, so a glucose screen, and even a liver screen.
Liver enzymes,
exactly. Yes.
So another really important thing, you already mentioned it as being one of the most important things we do, is immunizations. And I cannot agree more.
Yeah.
And a lot of the well child schedule correlates with when children are due for immunizations. Can you talk a little bit about what immunizations we do and kind of the time frame for those?
Yes. I think in terms of, I always tell families, if there's one thing that I feel good about, is about the vaccines that my patients are getting every single day. That vaccines save lives. We have them in the first 2 years of life. And in the first 2 years of life, parents are going to see that usually we start very early at birth. We start at birth with the hepatitis B vaccine. It's an excellent, safe vaccine that is preventing all the things that can happen when there's chronic liver disease from this virus. So we start at birth, and then we do kind of like a 2, 4, and 6 months are kind of like very common ages where infants are going to be getting vaccines at that time. We do boosters, and that varies across the country, but usually we do boosters at either 15 or 18 months of age of the same vaccines that they usually get at 2, 4, and 6 months. At 1 year of age, we do three very important vaccines. We do the measles, mumps, and rubella, the MMR vaccines, and the varicella vaccine, the chickenpox vaccine, and also the hepatitis A. So there's 3 vaccines that happen at 1 year of age. We give a booster so a booster means an extra dose of vaccine so that the immune system of the child can respond and be aware, here it comes again. Now my immune system is really going to ramp up and be ready to defend me when I'm in encounter with the virus or the bacteria. So we do the boosters for measles, mumps, and rubella and varicella at 5, but that can happen between 4 and 6. So kind of like kindergarten vaccines. Then we have also a very important vaccine, which is the HPV vaccine, that we actually recommend starting as young as 9 years of age. It's a safe vaccine. It's one of the efficacy is 100%, with the prevention that it can afford, in that vaccine.
Right, the cancer prevention.
Exactly, it's cancer prevention for sure. So we do that when here at Mayo we recommend it start at 9. Parents might hear it also in other practices at 11, and those are kind of like the 11-year-old vaccines, the HPV vaccine, tetanus, and the meningitis vaccine. And then they get another booster before they go to college.
Perfect. We're near the end of our time, but I wanted to get to one last topic.
Yes.
That is a passion of yours, and that is about dental health in children. Can you talk a little bit about some of the new things that we're trying to do as pediatricians to try and promote dental health and dental equity for all children?
Yes, early childhood caries is the most common chronic disease of childhood. So we know that 1 out of 4 preschoolers already have cavities in their mouths, and that is 100% preventable. So we are partnering with the dental community and parents to prevent these by brushing their, by basically talking about oral health from the very beginning. So we start up telling them to brush their teeth as soon as the first tooth is out. So we start this as when they're babies, not when they're like 3 years of age.
Right.
We tell them to go to the dentist by first tooth or by 1 year of age. And we apply fluoride varnish that is a very safe, evidence-based varnish that basically we paint their teeth, and that protects those teeth from getting the cavities. But brushing their teeth is probably the most important thing that parents should be doing, and so it's kind of like a partnership, but that's exactly what we're doing.
Fantastic. Was there anything else you want to say kind of before we finish our time here, maybe about how parents can help partner with their primary care provider to promote their child's health? Yes,
I think that that's probably one of the most important things. So I definitely encourage parents to, first of all, don't be shy. And if you're shy, it doesn't matter, be shy, but write down your questions so that you can kind of like, this is what I'm thinking. And use that time with your primary care provider to really answer your questions. You need to help the primary care provider guide that discussion and what happens at that well visit.
And I tell families that majority of the time your questions are going to cover exactly my agenda that I want to get to. They'll ask about sleep or stooling or vision and all the kind of things that we're going to go through, and growth. So it's wonderful when they come in with questions. It makes for a more engaging and I think productive visit sometimes. So
yes, I agree.
Absolutely. Well, thank you so much for joining us.
No, thank you.
And thank you everyone who watched. You can catch the next Ask the Mayo Mom on Facebook Live. It'll be a question and answer session again on December 19th at 11 a.m. Central Standard Time. We're going to be talking about an incredible area of advancement. It'll be fetal surgery for spina bifida and how it's improving outcomes for children. Dr. Edward Ahn, a pediatric neurosurgeon, and Dr. Rodrigo Ruano, maternal fetal surgeon, will be joining us for that discussion. Thank you, everyone, and have a wonderful day.